A good day to you. Let me try to bring you a little COVID update, COVID science and reason. Today it is reported in the Daily Mail of UK that remdesivir can cost up to over $4,000 for the regime for one patient, whereas the cost of the drug for production was about only $10. So remdesivir has a history of charging exorbitant sums of money, rather Gilead has. For hepatitis C pill, they wanted to charge for a pill $1,000. So when FDA opts to do a trial with a very expensive drug, permitting its use under emergency regulations, and does not pitch for hydroxychloroquine, cheap, without a brand, and tried over 15 countries in the world and reported to be effective in many trials, including the University of Marseille's trial with two well-known professors in France. They have treated over, last published one was 1,061 patients treated with hydroxychloroquine, 91% cured, and not one single cardiac issue. So then you understand there is a problem when such an expensive drug is rushed through clinical trials and the simpler one, effective for a long period of time and quite safe, is not tried. And UK continues to suffer with no proper drug regime at all, high death rates, though Oxford is doing a trial on hydroxychloroquine. Then the American Association of Physicians and Surgeons, 800 odd clinicians are saying, allow us to prescribe hydroxychloroquine, proved effective all over the world, allow us to prescribe it early as possible because hydroxychloroquine is effective when given early as possible. I'll explain again. The spike protein of the COVID virus attaches to the ACE2 receptor of the host cell, be it lung cells, red blood cells or whatever, and hydroxychloroquine acts exactly at the point to stop the virus attaching to the host cell and getting inside. So it is the best drug for prevention or for treatment, but it is not tried in UK. And in US, of course, it has been prescribed widely in hospital situations and in Mayo Clinic and in other places trials are being conducted. All over Asia, Sri Lanka included, we have had very good results with hydroxychloroquine and very low death rates. Coming to the low death rates, what are the factors involved in high death rates in another country? In the countries, one, inadequate vitamin D because of inadequate sunlight. Two, the subject I am covering is why high death rates in some countries. Two, vitamin D not functioning properly because of statin use. This is a technical subject. Statins interfere with vitamin D, which is cholecalciferol metabolism, and with omega-3 acid synthesis. Omega-3 acids have to come from fish or animal sources, or else it has to be synthesized in the body. And statin interferes with the synthesis of omega-3, which means you have to take omega-3 from outside. So if we are long on statin therapy, it is safe to take vitamin D and omega-3 during this period. Omega-3 produces SPM, much needed in the immune cascade. There is the specific pro-resolving molecules involved in the immune cascade, and omega-3 acid is used to produce these molecules. So if you have continuing cytokine issues because you're on continuing flu shots or other inflammations, then you are low on these important molecules in your immune system. So it is best that your immune system responds to natural sources to develop immunity the way God has designed immunity to be developed. Omega-3, so that's interfered by statins. Statins therefore will weaken immune mechanism. What do you think? We should take therefore additional vitamin D and omega-3 during this time if you're on statins. So one issue with vitamin D. Then if you have had the BCG, of course your you get trained immunity, activated macrophages working in your body. That is an important reason, and a study has reported this, that why countries where, like Sri Lanka, where the BCG vaccine for tuberculosis was given since 1960 globally to everyone, it is effective. The cellular immunity helps in viral invasions. If you have had many influenza shots, that will create a cytokine reaction in you, and epidemiologically, countries that are getting frequent influenza shots every season have produced more deaths. That's it. Then if you have more commensal bacteria exposure to outdoor life, less antibiotic intake into you through the year, you have more commensal bacteria, that is bacteria that you need in the body, good fellows, doing the good things and developing immunity for you, then your infection will be less severe. But if you are in a culture or country that constantly antibiotics are prescribed for the slightest thing, then you have removed the helpful commensal bacteria that work in your body to build immunity from inside. Seventh reason, if you are more used to outdoor life, the sunlight, in touch with green and grass, and even the mud, they have found in children who are running around in the garden without socks and shoes or falling over balls and whatnot, they have better immunity than the fellows who are cloistered inside the house and all the time on pixel screen. Then a serious issue has to be discussed. How to make your immunity unstable? Consider this. Treat active infection with polyclonal globulin therapy. So many people are suggesting polyclonal globulin therapy, and some countries are trying to isolate. Let me take down a note. Some countries are trying to, some laboratories, some countries are trying to isolate and give polyclonal globulin therapy to an infected patient infected with COVID. Now this can be done for other infections. What will happen is, certainly if the patient is very ill on their throes, because you did not give the hydroxychloroquine earlier, you did not give the low dose aspirin earlier, all those early therapy, you did not give the steroid earlier. Now I have done clips on this, so you'll have to refer to my earlier clips to understand where I'm speaking from. And if you have not followed my earlier clips, you need to send, if you want to follow, please send a WhatsApp message asking for the clips to +94 77 49 59 214, +94 77 49 59 214. Please send a WhatsApp message either asking for my spiritual messages or the COVID science messages, or the third kind of message is about what's going on at present. You can ask, and my digital science messages, you can ask for any of those messages. So we are looking at this globulin therapy. So if you give external globulins early, body will not develop its own immunity. It's very important. Our own body has a design system of developing immune memory with CD8 lymphocytes, activated macrophages, and also with IgM molecules. So if you give externally lab synthesized globulin, you don't develop your own immunity properly, and you can again get into problems later. That is why deal with the issue with low dose aspirin to prevent the coagulopathy. Secondly, to give steroids on the 5th day as recommended by the North Vermont University. Steroids is prednisolone, give it on the 5th day, and isoniazid to protect the heme backlash and the cytokine storm. Now also you will find, if you read medically, you can take the plasma out and send it through filters and remove the immune inflammatory mediators that are attacking the body, where the infection is. You can remove it by sending the plasma through filters, but that is very complicated treatment, possible only in advanced centers. All that can be prevented if the COVID infection is treated early with hydroxychloroquine, as Sri Lanka does, India, Pakistan, Bangladesh, Turkey, many countries do. And also, thankfully, because of President Trump insisted on it, many centers in the US, in the hospitals, use this therapy. Then give seasonal vaccines with new virus strains all the time. Cytokines will remain high. What's the subject I'm covering? Why is the immune imbalance? Your immunity gets unstable and you will react worse with COVID, children, adults, or anybody. So during this time that COVID has been unleashed, you will have to think through. Doctors, public will have to think through, why do you take so many flu shots? So one important reason I just discussed, why tropical countries will have a lesser severity of COVID, because our immunity is not meddled and interfered by constant flu shots. That's the reason. So giving seasonal vaccines with new virus strains will provoke cytokines. Now cytokines are part of our immune system. So our immune system must remain quiet till it faces bacteria or virus from outside. If our immune system by flu shots or other things are constantly provoked, you see, then your cytokines are always on the boil. And that works against immunity. So you must understand there is system immunity and there's an unnecessary immune reaction by meddling with immune provocators, which you get in vaccines and many other things. So the way you eat your food, all kinds of e-substances that go with processed foods, all those work against immunity. Then giving multivalent vaccines, then your immune memory will not be stable. So when a child is given so many virus strains, then you don't develop immunity. Now, 2019 November, those countries that received the last season influenza shot with many strains, they are the countries where the COVID infection was very severe. That's the problem. And even in US areas where the flu shots were in large numbers, those will be the areas in which COVID infection is also severe. Where people have been wondering, why is it that in some places COVID infection is not severe and some places it is severe? So with every vaccine you have adjuvants that cause a cytokine excess, which will consume these very important molecules called SPMs. That is special pro-resolving molecules in the immune cascade that are there to modulate the immunity. All this body forms on its own. You don't have to think about it. It's getting formed because that's the design. SPM, special pro-resolving molecules, they'll be depleted when so many other extraneous, external adjuvants and immune stimulants are given. And when you use antiseptics all the time, you have to be careful because there's good commensal bacterial input that keeps our system going. And then I discussed just earlier, too much of antibiotics, that's the same thing. Commensal bacteria is in our throat, in our sinuses, in our upper respiratory tract, and certainly in our gut and even in our skin. There are fellows who live on, that is part of our system. For instance, in the gut, commensal meaning live together bacteria, okay? I'll do all right for you. Those bacteria, when they're there, they produce vitamin K. Besides, when they are there, the pathogens cannot come and multiply. So when your commensal bacteria are low, they give you some kind of cover. Then the evil, virulent fellows will come and get lodged and you get diseases. That's why you must not go to your doctor and say, "Doctor, give me antibiotics." If it's a viral flu, it'll just go away. You don't need antibiotics. So don't go and tell the doctor, "Give me antibiotics," but he'll be pressured to give you antibiotics. Other, you'll go to another doctor and he will give you antibiotics. So this is the wrong game. That when you give adjuvants in the vaccines, all vaccines have adjuvants, you scuttle your cellular immunity. Now this is a little technical subject. Now our body immunity has in the blood antibodies. Those are gamma globulin protein molecules. But in our blood and in other systems, in between the tissues, we have very valuable cells that also develop a very essential immune system. More stimulants you take from outside, you scuttle that trained immunity of the cellular system, which works for us all the time. So in Sri Lanka, when as children people got the BCG, we have trained immunity for other things. Now BCG vaccine was given only from 1960. So those of us who were born before that, don't deny your age, those of us who were born before that, when we went to the ward, before we went to the ward in medical faculty, we were asked to take that BCG shot. Now of course children are given the BCG shot, so they have lifelong immunity to the tuberculosis bacillus, which works very well for rest of our immunity. So at this time of COVID, anybody giving a flu shot, BCG shot, BCG vaccine is a good thing. Now in England, they are reporting children getting immunological reactions during COVID infection, a disease like Kawasaki disease. Now Kawasaki disease is an immunological reaction in the small arteries of children, usually manifesting in their hands and feet, that can be settled by giving a BCG shot. So in countries where the BCG shot is not given, COVID infection has been severe. Then a little more about the cerebral effect of COVID. I have done this now before, I have done this before, but I'll cover it today also. Some young fellows at the age of 40 have fallen dead because of cerebral involvement in the COVID infection. What happens in the COVID infection is, it's not a pneumonia in the lung, it's not like ARDS, it's not like the SARS, acute respiratory distress syndrome. It is not like that, which means this new virus is completely different from the SARS virus, CO1. This is COV2, that is COV1. Therefore, this is not a natural mutation. COV1 pathology is completely different from the present COV2 pathology, which is called novel coronavirus or COVID infection. So Professor Luke Mancina, who is the professor who won the Nobel Prize for HIV, describing HIV, he categorically says this virus has been created with molecular tools. If you need that clip and reference, we can send it to you. Then Dr. Judith Mikovits is on record about all the things that went on in the CDC regarding RNA viruses, and her professional stand is something we have been thinking about ourselves, that RNA viruses don't produce proper vaccines. Now, when we were small, we got the triple vaccine, which is a bacterial vaccine, excellent vaccine. Then I already told you we got oral polio virus vaccine, which was a very good vaccine. Then came the MMR vaccine and rubella, measles, mumps, with adjuvants added, 3 viruses together, we began to have problems. From that time, people have been watching what are the real effects of MMR, what is it doing to children, to their brain, and so on. So there has been a big discussion or debate about autism and everything else. Then came the RNA viruses along with the HIV virus, for which nobody could make a vaccine in spite of trying very hard. Now in recent times, we have had SARS, we have had MERS, we have had Ebola, and where are they coming from? So in 2014, the American government prohibited gain-on-function research. What is gain-on-function research? Making a virus more virulent. So what did Dr. Fauci and CDC do? They shifted gain on function research. What is gain on function research? Making a virus more virulent, making an animal virus to be able to jump to human beings. That is an artificial thing. So when 2014 the American government called a moratorium on it, gain on function research with viruses was shifted with the $7.4 million to Wuhan laboratories. So CDC has been active in Wuhan, and it is from one of those laboratories that this virus leaked. That's a fact. So Indian scientists have also analyzed the virus and said the same thing. Newsweek ran an article on this, regular article. No one can deny that anymore. So that's as far as the origin of the virus, and why these RNA viruses, we can't have much hope on them about producing a proper vaccine. At present, Oxford is trying to make a proper vaccine, and a well-known reputed scientist, Dr. Sarah Gilbert, head of the Jenner Vaccinology Institute of Oxford. Now, it is to be seen whether Oxford process of making vaccine, people will wait for it. It will take time. Now, Italy is saying they have produced a virus vaccine. And Italy and Wuhan has had very close relationships because of leather trade and all that. Italy has also signed the Road and Belt Treaty with China. So who funds Italy vaccine? Then will there be a real battle between which vaccine will be accepted? Will they wait for the Oxford vaccine, or will there be a global program to legalize a vaccine of non-reputable origin? Then you know that it's a real end game, that there are people waiting to vaccinate the whole world and put a chip in the hand. So it's a strange thing. Virus comes, they're already ready with a chip to put in their hand. They make prophecies and speculations about a pandemic. Prophecy does not belong in science. So where did this speculation come? So when speculation is made, a second wave will be there. Where is that speculation coming from? Now, the other day, the Tanzania head of state, he has sent papaya juice and some other things and some animal blood here and there, putting some fake names and so on to their coronavirus testing institute. And they return all that COVID positive. So big ha-ho in Tanzania, what is coming as PCR positive? Of course, depends on the lab. Now we know in our country, our virologists and our laboratories have been commissioned carefully. People keep asking, why can't you do more testing? Simply because you need trained technicians. So we have increased our testing to about 1,500. So all over US, there's a hue and cry. How many positives are really positive? And whole lot of faulty test kits have been returned to China by many countries. So the plot thickens, isn't it? So in the midst of strict science, you have some things that you need to speculate, like in politics. Now, since that's not my training, I like to stick to science. But you have to work it out and refer other sources who may be more authentically, authoritatively speaking about those things. But we all need to think. That's why this talk is for public and for doctors. This is about, we took some time about the making vaccines for the RNA virus, which has not been a successful thing. Then the question arises, if there was a simple drug doing chemoprophylaxis, why shouldn't we try that instead of a very expensive vaccine, which has other effects? Vaccine storage, vaccine transmission is very costly. It needs a refrigeration line and, not break it up and so on. For instance, we control malaria in Sri Lanka, and many other countries have done that, giving chloroquine as chemoprophylaxis. If you take chloroquine and go, when the plasmodium, the organism responsible for malaria, is chloroquine sensitive, you don't get chloroquine. You don't get malaria. and then we destroy the vector, the mosquito. So Sri Lanka is rid of malaria. When you can do that, when a global organization makes the malaria vaccine, you really ask, what's the meaning of that? When world over chloroquine is effective for malaria prophylaxis. Now trials are being done whether hydroxychloroquine, a derivative of chloroquine, will be effective for preventing COVID entry. So if there's a cluster of people where 1 or 2 people are COVID positive, if you give hydroxychloroquine to all rest of the 100, will they be prevented from getting infected? Oxford is doing a trial, Columbia University is doing a trial, in Sri Lanka also there's a trial on those lines. That is about preventing getting COVID by taking hydroxychloroquine. So Oxford is also doing a trial. Why I keep saying Oxford is also doing a trial is because if Oxford does something, there's a reason for it. It needs to be investigated. Whereas in US, FDA quickly plunged into doing a trial with remdesivir, and now Gilead has the patent for it and a history of making extremely expensive drugs. And they are offering it, a course will cost about $4,250. And hydroxychloroquine course will cost about $1, $2. So you need to understand there's more than science in all this. What other topic would I like to? I did which countries get more severe COVID, the situation with RNA, yes, then situation with RNA vaccines and making vaccines, RNA viruses and vaccines, then why the immunity gets unstable, we did. Now here are the issues. Why is the virus so feared? Why is the virus so feared? Because this COVID virus waits on surfaces. Unlike any other virus, it doesn't spread only from mouth to mouth or droplet to droplet. Droplets can be found on surviving on envelopes or parcels and so on. So that's a fearful thing. So there's a problem with that. Why people are fearful about that? So this has brought a phobia. I don't know where will I catch the virus from. So you're asked to keep your fingers together. And mask is anyway useful for you to get to understand that there's something that you should be careful about. Secondly, how does hydroxychloroquine work? I have explained that in great detail. Why is it that hydroxychloroquine can be effective for prevention? I have said it is possible. I have explained that also. Why is our death rate low? I told you BCG and other things. What may be the role of BCG? Good to give a shot even now. What happens in the lung? I have described this in earlier clips. Basically, in the lung, the virus multiplies and the virus protein attacks hemoglobin. Hemoglobin splits, then our blood doesn't have hemoglobin to carry the oxygen. Then the patient will begin to breathe very deep and hard. No point putting in a ventilator. Ventilators are helpful when person can't breathe. But the problem is person is, inspiration, expiration is okay, but in the blood, hemoglobin molecules are being destroyed. And if you like to see, you might say diabolical. It is diabolical. Hemoglobin molecules are destroyed by the virus. Therefore, hemoglobin can't carry the oxygen and hemoglobin can't release the carbon dioxide to go away. So this happens when people climb tall mountains like Himalaya without oxygen. Then the blood begins to coagulate and so on. So that is why Prof. Sharif Sultan, the president of the British Vascular Surgeons Association, studying the intensive care unit situation, he has recommended that you treat the coagulopathy with hyperbaric oxygen. That is oxygen under high pressure. When you keep giving oxygen under high pressure, the patient does not get hypoxia. Blood begins to saturate with oxygen. If you allow the blood to be hypoxic, the bone marrow puts out a lot of red blood cells and the coagulation problem increases. As I said earlier, if you give low dose aspirin early, you prevent the platelet clotting and beginning the clotting mechanism. Besides that, they have found a problem, the problem called the antiphospholipid syndrome. This COVID virus creates a problem in our body. In the blood, there's a phospholipid that prevents coagulation. This COVID virus attacks that, and then blood begins to coagulate in the bloodstream itself. So for all this, simple low-dose aspirin, as you take it for heart, cardioprin is effective. And also North Vermont University has been giving early preethyl prednisolone. Now, though you are listening to this, none of you can take any of this medication. A clinician must prescribe. You can't be using this medication yourself. No way. But I am giving you an understanding of the COVID pathology, why it is not a lung pneumonia, it is not a virus pneumonia, it's how the hemoglobin is attacked, red blood cells are attacked, lung cells are attacked with what technically is called a cytokine storm, which means there's a immune inflammatory hyperreaction, exaggerated immune reaction. There are diseases called autoimmune diseases. This also behaves like that, only that this is very acute. So it is attacking lung cells and it is attacking the hemoglobin molecule. So you have to treat that. It is treatable. Earlier treated, the better it is. Ventilators are not the way to go. Oxygenators are the way to go. That is described by Professor Sharif Sultan, President of the Vascular Surgeons Association, Britain. He has described it quite very well. What are the other questions? I have told you why is the death rate high in some countries. What is the difference between ventilators and giving hyperbaric oxygen? In fact, Professor Sharif Sultan said, if your hospital doesn't have a hyperbaric oxygen chamber, specialized units have hyperbaric oxygen chambers, because people who try to gas themselves to death getting inside their vehicle and getting the exhaust to enter the vehicle which shutters up, they get carbon monoxide poisoning. When you take to hospital, they are put inside hyperbaric oxygen chamber, so more oxygen is high concentration of oxygen breathed in, and their life is saved. Prof. Sharif Sultan said, if we want to treat this, if large numbers come in, keep an aeroplane running. Aeroplane has high pressure in the cabin and oxygen in high concentration. And he also suggested to give an aerosol of a substance called prostacyclin. When you give prostacyclin as an aerosol, the capillaries of the lung begin to stabilize and the clotting stops. But when you give the simple low-dose aspirin, in the brain itself, those little microemboli that can cause clotting, embolism, and stroke stops. So this disease, you don't have to fear. It can be handled carefully. The problem is that people are not thinking through the pathology in many countries. Countries that handle this problem best are South Korea, Sri Lanka, Bangladesh, India, and Pakistan, and Turkey. US, because of President Trump's insistence, many places are giving hydroxychloroquine in spite of Anthony Fauci. So Brazil is handling this well, but Brazil has a problem with the infection. So two different things. If your public health system is not good, infection spreads. If your contact tracing is not good, infection spread. Now in Sri Lanka, we are blessed because we have a very extensive public health system. So our HIV contact tracing is one of the best in the world. We have been awarded for it. You know, HIV contact tracing is sensitive. Doctor has to be very nice, and you have to get our health trace people who trace contacts to do so sensitively. So similarly in Sri Lanka, just like in Israel, we have got to tracing every contact as much as possible. So it's a delicate thing. People try to hide it. You have to encourage them. But every single cluster we have traced. 27 clusters in Sri Lanka are COVID-free. we have one major cluster in a Navy camp that been systematically surrounded, meaning every contact is either brought in or in his own home village. They are encircled, surveillance, self-isolation, and the self-isolation is enforced. You have to enforce. We are acting under old British law for quarantine. So our DGHS, the Director General of Health Service, is the boss in that old quarantine law which the British had. We still have it in our nation. Many other nations might have repealed it. We still have an old British law on homosexual behavior also. So British got some things right at that time, and they're not getting some things right in this time. So we have done well, but we can't be at ease. We have to be constantly on the watch. In our country, we do what is known as sentinel testing in a cluster. So you get hold of everybody. Now recently, chap in Rajagiriya, that's about 2 kilometers from my home, he is a drug addict. It's a problem with drug addicts and with prostitutes, because they will have body contact behavior and they will hide it. They will not say it. Now I'm not saying those who are getting infected are all drug addicts and prostitutes. Not so. Many Navy contacts got from the Navy men. But in this case, it was a drug addict, and they rounded up 30 of his contacts and took them into quarantine to a faraway place run by the army. They are doing a great job, and they were all tested and none were COVID positive. So by the great mercies of God, maybe, he was taken in, and in that locality they did some sentinel testing. Maybe they select the immediate 100, and then they found no COVID there at all. So that was a great thing. That was a great relief. That's how we are. So we at present have this one main cluster, the Navy issue. Now in the northern province, we had a case with an infection that spread from a church service, and that was quickly 300 contacts were quickly brought under surveillance. A village with 300 people was brought under surveillance. Now for the last 20 days, no COVID positives at all. For the last 22 days, no COVID positives at all in the whole of the northern province. That's a great achievement. So that's how good our provincial director has been in the northern province. The others who work, the PHIs, MOHs, who work non-stop very hard. It's an enormous amount of work, but they are all given PPE, good personal protective equipment. Sri Lankan government has looked after their health staff extremely well. As you know, in UK, 7 doctors are already dead. Many are infected. More than 30 doctors are infected in UK. Some are struggling for their life in intensive care units because UK does not give hydroxychloroquine till it is proved. That is UK. What are the other questions I have? Is steam inhalation useful? Yes. If you go into a crowded place without mask and you are uncertain about the place, go home, take steam inhalation as hot as possible 3-4 times. And Indians are saying drinking hot water, gulps of hot water. If you feel uncomfortable having gone somewhere and come, you don't know whether you were exposed or not, it's a useful thing to do. Anyway, in hospitals, our hospitals, steam inhalation is given even for COVID positive people, because you reduce the virus load in the pharynx and in the throat and in the nostrils and maybe even in the sinuses. Then some are recommending drinking tea many times a day, hot tea, because you have methylxanthine that promotes immunity. And when you, of course, know that when you drink hot tea, the best tea in the world is Sri Lanka tea. That's not a medical statement. What about drinking tea? Alcohol is best avoided because alcohol reduces immunity, and alcohol also makes you stupid in behavior, and you may forget about your self-distancing and so on. A few more things. Consider this. Believism, in fact or fake, is incurably ingrained in humans. Check out what belief system speaks in you since your first 25 years of nurturing and training. Did those belief systems fracture and disrupt? what you got in your formative days? What do you now believe? How pressurized, influenced, intimidated, infiltrated, and seduced are you by the global culture? Got me? Yeah. This is on my Facebook wall. Effects of a global reaper culture. I can survive wherever with whatever. For my sake, anyhow, somehow. Changing milieu as I please. When I am done, it's done. That's the global culture many people are adopting. Home, family, nurture culture, which is the way God designed the world. I grow together in season with others who become relational, fabric, sharing, caring, investing, receiving dividends rather than rapacious profit. So I pass on what I have to another generation. The global culture, death is considered collateral damage. So Dr. Judith McWaith says in the CDC, when they got on to gain on function research on coronaviruses, they thought death is collateral damage that cannot be avoided. So denewed reverence for life, code death, digital games teach children that, and you know the Blue Whale app and other apps that promote suicide. So elimination games, abortion, surgical solutions to sociological problems. Now you can see I have done a very strict scientific, rigorous rigor with scientific rigor. I have done the issues regarding the COVID situation. Very quickly about treatment itself in the COVID treatment schedule, I have suggested some things like how to avoid coagulation with early aspirin, low dose aspirin. Now you can't try it yourself, only clinicians can try this. Clinician must prescribe. Also you can prescribe isoniazid to avoid heme radicals circulating in the blood, making the coagulopathy worse. Yes, these are documented. Some hospitals are doing this. And also methylprednisolone can be given early. University of North Vermont is doing some excellent work on the immunology of COVID. I have references to all this. If you need them, please send me a WhatsApp to +94 77 49 59 214. Now here is a little more of the same trend. Cursing superiors using hunger or disease has become a style. So when you get people on this addiction of going on, believing fake news and criticizing without having expert knowledge, people are addicted to this. Everybody thinks second-hand knowledge makes you expert. So you feed on fake, and fake is an addiction. You feed on some more fake. Without first-hand training in a field, you can't have a proper opinion. So my main training is pharmacology. At the time we were trained, I'm Dr. Lalith. My last post was as head of department of a state medical faculty. So my main training is in clinical medicine, internal medicine as a general physician, and in pharmacology. In our time, we were trained in pathology, virology, microbiology, immunology, quite a bit. But if you ask me how does epidemiology work, I will have to say you'll have to ask the person who has done community medicine, you'll have to ask an epidemiologist. I understand it, but I can't explain to you. So should Sri Lanka lift up or release lockdown? I don't know. I only have a layman's knowledge. We all hope we can release the lockdown and people can get to work and earn a living. But then how scientific it is, how long to close it, I don't know. So kids get dissociated from parents because they live on a digital culture of spook, magic, monsters. And they are very rude, reckless with their words. So already there's a separation that is brought between parents and children. I have done a detailed talk on this about keep your family intact, keep your nation intact. So this I think we have covered all the sections needed for today. It was a little long today. Thank you for listening. Pass this clip on to your friends. Yesterday I did that. Obesity contributes to COVID fatality. They are saying under the age of 40, if your metabolic index is more than 50% of what it should be, your fatality rate, your chances of getting very severe infection and mortality goes up by 50%. So that's a dangerous thing. What can you do right now is to attend on your vitamin D and your omega-3. That is critical, or that is helpful. That can make your COVID infection less severe. Thank you.